Venezuela faces a healthcare system in structural collapse. This is not a crisis of will, not a crisis of need, a crisis of access. Medical supplies are scarce, hospital capacity has declined, healthcare professionals have left the country. Basic infrastructure fails, hospitals lack continuous water and electricity, pharmaceutical availability is inconsistent. Shortages cycle through healthcare facilities. The system cannot meet demand. Venezuela depends heavily on imported medicines. Venezuela imports 85% of all pharmaceutical products. Pharmacies report a 60% shortfall. Local production cannot meet internal demand. The supply chain is vulnerable. Patients interrupt treatments. Patients leave the country. Patients go without. These conditions are documented by the World Health Organization, the Pan American Health Organization, FAVN, Human Rights Watch, and the International Medical Corps. A significant portion of Venezuelans cannot access timely health care. 18.8 million Venezuelans lack access to health services in 2021, including over 10 million with chronic diseases. The situation worsens in rural areas, indigenous communities, and lower income segments. This is where barriers are greatest. Chronic diseases demand continuous treatment. HIV, cancer, metabolic disease. Treatment is not available. Patients suffer. Epidemiological indicators are deteriorating. Malaria cases surged 205%. Tuberculosis is increasing. Vaccine-preventable diseases are re-emerging. Maternal mortality is up 180% since 2000. HIV patients dying because antiretroviral medications are unavailable. The system cannot protect the most vulnerable. Access to medicines is the most pressing challenge. Pharmacies and healthcare facilities cannot meet demand consistently. The need is clear. The need is sustained. The need is large-scale. Venezuela requires immediate and continuous access to essential medicines, medical supplies, and healthcare equipment.
The question is no longer whether the need exists. The question is, what is the solution? Waypoint has gone beyond analyzing the problem. We have developed a structured, operational solution designed for execution. We have identified suppliers. We have mapped logistics routes. We have established a network capable of responding to Venezuelan market demand. This is not theoretical. This is ready to operate. The suppliers. We have identified active suppliers in the Colombian market, pharmaceutical companies, medical equipment distributors, hospital supply providers. All are established operators with available inventory, regulatory compliance in Colombia, and immediate response capability. We know their product lines. We understand their capacity. We control their pricing. The routes. We have identified and validated 3 logistics corridors into Venezuela: air transport for urgent critical products, land transport through cross-border points for high-volume shipments, maritime transport for cost-efficient, large-scale distribution. Each route has been assessed for regulatory requirements, customs procedures, and operational feasibility. All routes are fully viable. The in-country distribution. But reaching the border is only part of the solution. We have established a partnership with a Venezuelan distribution operator that has infrastructure, legal standing, and operational experience. Getting product to the border is half the mission. This level of integration is our differentiator. We do not simply connect supply and demand. We structure and execute the entire supply chain.
Waypoint is a specialized international operations company built for complex markets. We work with governments, international organizations, and private sector partners to encode large-scale supply operations in environments where ordinary logistics companies cannot function. We don't just connect buyers to sellers, we structure the entire supply chain: sourcing, compliance, transport, customs, in-country clearance, and last-mile delivery. We ensure operational continuity. We ensure reliability. We ensure accountability at every stage. In complex environments, execution capability is the defining factor. That is where Waypoint delivers. We have the suppliers, the products, the routes, and the distribution. The solution is not a proposal. It's not theoretical. It is operational. It is now.
Venezuela's healthcare crisis has a real response. Waypoint Medical, and we are ready.
Every day,
Medical products are being blocked from Venezuelan patients. Every day, people suffer. Every day, the system deteriorates further. The time to act is now. Suppliers are identified. Routes are validated. Distribution partners are in place. The network is operational. Capital is ready. Regulatory compliance is assured. The pathway is clear. Waypoint Medical. The solution is ready. The choice is yours.